Several methods are used to remove unwanted fat deposits from the stomach area. These tummy tuck procedures redefine the body and can improve self-esteem. Dr. Robert Brueck of Associates in Cosmetic Surgery discusses the procedure and its benefits.
Tummy tuck is related to the abdomen, and it's the removal of excess skin, sometimes excess fat, and sometimes we repair the rectus muscles. Those are the midline muscles. Many times women after pregnancy will have a weak lower abdomen and they have this bulging out, so we have to bring those muscles back together. And interestingly enough, not only women, but men. I've done tummy tucks on many, many men for the same reason: excess fat, excess loose skin. And it can vary. It can be a mini tummy tuck where there's just a little loose skin and you might take a little fat, to people that have a functional need. In other words, it's not necessarily for cosmesis, but in order to improve their functioning. So it can be cosmetic, it can be functional. It can be a little skin or a lot of skin.
Who are the typical patients for a tummy tuck?
Most of the candidates that I see in my practice are women who have finished having their children and now come in. They've got multiple stretch marks or stria, they've got loose flabby skin, and there's this constant battle between the husband and the wife. The husband says, "Honey, I love you the way you are, just do a few more sit-ups." And the wife says, "Well, I've been doing 200 sit-ups a day, but I still can't get rid of it." "No, maybe do 250. And then out of desperation, they come in, they see me, and I examine them, and I say, "You know what? You can do 20,000 sit-ups a day. It's never gonna go away." So most of the women are, I would say, 30 to 40, 45. After having children, they get embarrassed, like they don't want to wear a bikini anymore. They wear a one-piece, and that's the majority of people that come in to see us.
Dr. Brueck discusses the surgical procedure.
It's a relatively straightforward operation. Interestingly enough, I've been doing them for 32 years. When I started out, people would be done in the hospital. Now we do them all outpatient and they go home. The operation can take anywhere from an hour to maybe 2.5 hours, depending on what the patient has done. Many times they go home with a drain. We give them an abdominal binder, and pretty much that first night I tell them, go to bed. Put a pillow under your legs to take tension off your incision, and most of the time they just sleep like a baby. And then the most important thing for patients to understand is after a tummy tuck, especially if you tighten the muscles, early ambulation. So I go ahead and I have patients get up the very next day. I have them wear compressive stockings and ambulate. I don't want them sitting in a chair. And there's a little discomfort, but pain pills are more than adequate. And most of the stitches are buried, so they don't even have to have the stitches out. And the drain comes out in 4 or 5 days. And they're thrilled because A, flatter abdomen, B, tighter abdomen, 3, stretch marks are gone, and now they don't have to do sit-ups anymore. So they're happy.